Hello and welcome to Pregnancy Info. Today we are going to discuss the topic how to avoid pregnancy. Contraception or birth control helps prevent pregnancies and plan the number and spacing of children. There are many options to choose from to prevent pregnancy. Some methods are more effective than others, and no one product is best for everyone. Birth control methods. Birth control falls into two broad categories: reversible and permanent. Reversible methods allows individuals to stop birth control when they would like to become pregnant. Permanent methods cannot generally be undone once completed. Reversible methods of birth control. Long-acting reversible contraceptives. These contraceptive methods allow individuals to prevent pregnancy for multiple years. Copper intrauterine device or IUD. The copper IUD contains no hormones and is made with copper and plastic. The copper acts as a spermicide and prevents sperms from reaching and fertilizing an egg. Hormonal IUD. Hormonal IUDs contain the hormone progestin, levonorgestrel. The progestin causes cervical mucus to thicken and the lining of the uterus to thick, which keeps the sperm from reaching and fertilizing an egg. Implantable rod. This is a thin matchstick-sized rod that contains a progestin hormones is put under the skin on the inside of your upper arm. It stops the ovaries from releasing egg and thickens the cervical mucus, which keeps sperms from getting to the egg. Contraceptive shots. The contraceptive shots is an injection of progestin, one of the hormones found in birth control pills. Individuals using this method get the shot from their doctor once every 3 months. Short-acting hormonal methods. These contraceptive methods use hormones to keep the ovaries from releasing eggs and possibly prevent the sperm from reaching and fertilizing an egg. Birth control pill. This method is also known as oral contraceptive or the pill. There are two main kinds: combined pills, which contains estrogen and progestin, and mini pills, which only contain progestin. Birth control patches. These birth control patch is a thin beige plastic square about 2 inches across that delivers hormones. Vaginal ring. This small flexible plastic ring is inserted in the vagina and contains the same hormones, progestin and estrogen found in the most birth control pill. Barrier methods. There are several birth control methods that involve using a physical barrier to block the sperm from reaching and fertilizing an egg. When deciding how to prevent pregnancy, the Center for Disease Control and Prevention encourages couples to consider methods that offer dual protection from risk for HIV and other sexually transmitted infections like STIs. Male condom. A male condom is a thin film cover that is placed over the penis and keeps sperm from entering a partner's body. Using a male condom consistently and correctly reduces the risk of HIV infection and other STIs. Diaphragm and cervical cap. The diaphragm and cervical cap are silicone cups that are used with spermicide gel or cream. It is inserted into the vagina and over the cervix to keep sperm from entering the uterus. Female condom. The female condom is a thin, soft, loose fitting pouch or sheath with a flexible soft ring on each end. One end of the female condom fits inside of the vagina to keep it in place and the other stays outside of the vagina. Sponge with spermicide. The sponge is a small disc-shaped device made of a soft plastic foam that covers the cervix and contains the spermicide nonoxynol 9. The spermicide in the sponge is placed inside the vagina, covering the cervix prior to having sex, and works with continuously releasing spermicides to kill sperms. Permanent methods of birth control. There are two options for sterilization, a form of contraception that is meant to be permanent. Number 1. Tubal ligation. In females, in this procedure, also known as having your tubes tied, the fallopian tubes are cut, sealed, clipped or tied so the egg and sperm can't meet in the fallopian tube. Vasectomy in males. This procedure involving cutting, tying or blocking the phase difference two tubes that carry sperms to the penis. Other forms of pregnancy preventions. The following forms of pregnancy preventions don't require any physical or medical materials. Abstinence. Sexual abstinence is defined as refraining from all forms of sexual activities and genital contact such as vaginal, oral, or anal sex. This method is the only 100% effective way to protect against pregnancy, ensuring there is no exchange of bodily fluids. Natural family planning and fertility awareness. Fertility awareness-based methods help women and couples become more familiar with the signs of ovulation and the pattern of the menstrual cycle to understand how to plan sexual activity to either avoid pregnancy or become pregnant. Lactational amenorrhea method. LAM is a form of natural birth control that relies on the new mother feeding her baby only breast milk for up to 6 months and having no periods or spotting during that time. Withdrawal. While having intercourse before ejaculation, a person pulls the penis out of the partner's vagina and away from the partner's genitals. It prevents fertilization but not allowing semen to enter the vagina so that sperm doesn't reach the egg. Emergency contraception. Emergency contraception is not a regular method of birth control. Emergency contraception is birth control that a person can use after unprotected sex. If you did not use birth control or if regular birth control failed, it should be used as soon as possible within 3 to 5 days after unprotected sex to prevent pregnancy. Emergency contraception methods are more effective the sooner they are taken. Emergency contraception doesn't work if the person is already pregnant. There are two main types of emergency contraception: emergency contraceptive pills and a copper T intrauterine device. So this is all about the methods to avoid pregnancy or the birth control methods. Hope you have found this video useful. Must share this video with the females who are going to avoid pregnancy in the future, and also comment in section that how do you find this video is useful or not.